Thank you very much for talking with us, Dr. Bovell. So you're chairman of the task force here at the Georgetown Hospital. You're also on the national task force. Could you, if you could, I know it might be a difficult thing, could you give us a sense of what is happening nationally to fight this pandemic?
So I'm actually not a member of the National Task Force. I'm a member of the Health Emergency Operations Center. That committee I'm a member of, as well as the chairman of the Georgetown Public Hospital Task Force. Nationally, it's important for us to know that we did not wait until we had the first case of COVID-19 confirmed to actually be proactive. We had already started in doing training of personnel. We had done triage training for persons or healthcare workers. We had done BLS training. We had started doing training on how to wear your personal protective equipment, what type of personal equipment you need, how to use it appropriately, how to remove it appropriately, in that way to protect healthcare workers on the whole. We also did trainings on how to take off the swab, which is the actual test in the nasopharyngeal swab, which is actual sample collection for the test, the PCR test, which is the official test that we are using. So it's important for us to know that no, Guyana didn't actually wait until we got the first case to start these interventions. It was as soon as we heard coronavirus is around. And once we were aware of COVID-19, it was started.
So what's been happening here at the Georgetown Hospital?
So at the Georgetown Public Hospital, we've been doing a lot of work. And I am lucky to be part of a great team. A team that has members from different departments of the hospital. So a great team indeed that has been doing a lot of work. We've been pushing out policies, we've been pushing out protocols, specific for COVID-19, not just infectious diseases, but specific for COVID-19. We've been able to create our second triage system, which is the E3 triage system. We've been starting to protect or not only our staff, but to look out for the persons that come to our hospital. And in that way, that's why we created our screening points, so that yes, some people will have to come to the hospital. And as you come to the hospital, you will be screened. So whoever is on the inside of the hospital will be protected, because notwithstanding, people still do get sick. And the persons that are sick are the persons with comorbidities most of the times. And those are the
comorbidities, meaning a lot of...
Yes, comorbidities like diabetes, HIV, TB, tuberculosis, cancer, all of those persons still come to our hospital. And so we have the responsibility to them to actually take care of them and avoid them being exposed to COVID-19. Because those are the persons that are going to be exposed to the severe form of this illness. And that's why it's pretty important. So the screening points were created. The triage area was created. In January, we started creating the isolation area, which is the isolation ICU. And that was retrofitted with to ensure safety for not just the patients that are coming to the hospital, the patients that are within that unit, and also the staff that are actually seeing these patients and catering to these patients on a daily basis. So these are some of the works that were being done.
Has there ever been a point where you were overwhelmed to the point that you can't handle people coming in for COVID?
So we have not reached that stage of being overwhelmed. We're taking it one step at a time. And with an organized approach, we should be able to cater to all the necessary needs for persons that attend to the hospital.
Dr. Bovell, obviously the regime of treating patients and just everything about COVID-19 has evolved over time, and it keeps changing all the time. If there was a particular significant change that you could talk about that you've had to put in place here at the hospital, what would that be?
So if it's a particular change, is that I'm not sure if that is a particular change, but we know that COVID-19 is being treated as with symptomatic treatment, meaning if you have a fever, I give you something for that fever. If you've developed a pneumonia, I give you something for that pneumonia. But we've also started putting things in place for persons that might have to actually need dialysis, because some persons might reach the stage where their kidneys are not perfusing well. And we've also put things in place for persons that would have heart problems, So we have machines to actually test their heart, check and see what their ECG tracings are. We have our monitors, we have our ventilators. If someone goes into respiratory distress and into respiratory failure, meaning that if they stop breathing, we have ventilators available to actually put them on that ventilator and let them carry through with that illness.
Doctor, a lot of people are still not taking this virus very seriously. If you were to tell them how bad this is, what would you say?
This is very important. You see, we are looking at just what our numbers are, but we are not in isolation. We're not a separate world. Guyana is not a world by itself. We are still communicating with others, right? We have some borders, and yes, we have closed our borders, we have closed our ports, and that is what helps us a lot. But what would help us even more as well is the social distancing. There are a lot of times people go out for what they call essentials, and it's not really essentials. Or sometimes they go with 10 members of their family, 5 members of their family, when one person of that household can actually go out for the essential items. They go appropriately clad. It's very important for us to know that social distancing is what's going to make a difference. I've said multiple times that in China actually said that if they had started social distancing 1 week before they had started, they would have reduced the amount of cases to at least 60% less persons. And if they had done it 2 weeks before they actually started, it would have been 80% less persons. Yes, we have the capabilities of treating persons, but we will prefer that you prevent getting this illness. So that's why social distancing is very important. It's not about being with your family because, hey, we have not seen each other in a long time and we're all in self-isolation, so you could come over to my house. No, it cannot be that. It has to be strict self-isolation. It has to be frequent hand washing, because that's also another important thing. Some persons have the fear that you can touch a surface and you automatically get COVID-19, and it isn't so. It's about touching that surface and then taking your hands to your face, your eyes, your nose, your mouth. And that's when you contaminate yourself with this virus. So these are things that are very important. We need to continue eating healthy. Guyana is a hot climate. We need to drink our water. We need to eat our fruits and vegetables. These are just things that will help us, help your immune system to be able to fight this illness if you get it. And then the other methods like the social distancing and the frequent hand washing will definitely help you with prevention of actually being COVID-19 positive. And ultimately, that's what you want. You don't want to be a survivor necessarily of COVID-19. You want to be able to say, no, I did not get it because I was able to do these preventative measures. And that's why you would see multiple persons on the news, multiple persons on the television screens, on your Facebook screen saying, hey, guys, social distancing. Social distancing is what is really going to help us throughout this thing, as well as frequent hand washing. So right now, as you can see, we are some distance apart, right? And this is an interview. This is not even in real setting. But at the end of the day, we are still maintaining our social distance. And that is very important.
And of course, we're wearing masks, but
Yes.
wearing mask alone doesn't help if you don't wash your hands and stay the distance.
Exactly. So that's another misconception that persons have, that once I have a mask on, I'm protected. It is not enough. It is not enough, because a mask alone does not protect you. You have to use it properly. You need to know how to put it on. You need to know how to remove it properly. Because if you do not know how to put it on, use it, or remove it properly, you're going to expose yourself even more. So some persons pull down the mask and they have a conversation, and that cannot happen, because that means you've now brought the virus closer to your nose, closer to your mouth. Some people touch the mask and then rub their eyes. And that's why, yes, sometimes we make mistakes, because hey, from the moment we were told not to touch our face, we realized this is when our face is itching the most. You must admit that. So sometimes we make a mistake and we touch our mask, but that's okay. Wash your hands immediately after that, because once again, as I've said, It's not because you touch the surface that has the COVID-19 virus, you're automatically COVID-19 positive. You have to take it to your mucous membranes, which are your eyes, your nose, and your mouth, essentially.
Great. Thank you very much for talking with us, Dr. Bovell.
Anytime. Thank you for having us.